Meanwhile, in Louisiana, the New Orleans area is experiencing the highest fatality rate in the nation. So let's discuss what's happening there with former Peace Corps Medical Director Dr. Steve Weinberg and Louisiana Attorney General Jeff Landry. Good to have you both with us.
Good evening.
Thank you, Shannon.
Mr. Attorney General, I want to read something from Reuters about why New Orleans in particular is having such a tough time. They say this: New Orleans residents suffer from obesity, diabetes, and hypertension at rates higher than the national average, conditions that doctors and public health officials say can make patients more vulnerable to COVID-19, the highly contagious respiratory disease caused by the coronavirus. Mr. Attorney General, our hearts go out to you, and there are all kinds of speculation about whether this was part of Mardi Gras and people didn't know it was being spread. What's the situation there on the ground tonight?
Well, look, I think everything you just read in Reuters is absolutely true. Louisiana does have a problem. We're not the healthiest state in the nation, especially in New Orleans. People come to New Orleans to have a lot of good food and a lot of good drink and a lot of fun. And of course, Mardi Gras, attracting crowds from all over, not just here in the United States, but internationally as well, probably increased the problem that we had with the coronavirus. And so, yes, New Orleans has become the epicenter for the coronavirus outbreak in Louisiana, but we're working hard to stem that tide.
Yeah, and one of the things you have there is the governor being very strict about people staying at home. There are exceptions to that, but he's had a pretty strict crackdown on that. And it's interesting now we're starting to get these articles about how we get back to our new normal, whatever that's going to be. And a piece in the New York Times today, an opinion piece by a doctor who's an infectious disease epidemiologist and dean of medicine at the University of Hong Kong, says this: we must all prepare for several cycles of suppress and lift policy, cycles during which restrictions are applied and relaxed, applied again and relaxed again in ways that keep the pandemic under control, but at an acceptable economic and social cost. Dr. Weinberg, is that sort of, your take on what the model will be until we have a vaccine that's widely available?
Shannon, I don't think so. There's a lot of articles being published now. There's a lot of junk science out there. Dr. Luong, who published this, probably an excellent doctor. It was a very scientific article. The New York Times, kind of hard to understand. But we really don't know if this is going to come back in cycles. Mitigation has been working well. And the key, I think, is if we get the right drug or drugs, I think it may take a combination of drugs to treat this disease, we'll be able to treat people early in the course of it. It'll go away, and we won't go into these cycles up and down, and we can get back to work.
Doctor, are you hopeful? We have anecdotal evidence. We're having small studies now, but are you hopeful that some of what is out there on the table will be enough to keep things under control?
I'm very hopeful, Shannon. I read probably 10 or 20 early publications, not even published yet. They're in letter form every day, and the studies all over the world. In many hospitals, 2 and 3 studies are going on in the same hospitals. My gut feeling is it'll take some sort of antiviral to kill the virus, and then some sort of autoimmune drug. The hydroxychloroquine works well in that. There's an Italian study where they use a drug that works very well for rheumatoid arthritis, because some of these people are not dying of the virus. They're dying of the body's reaction to the virus, called the cytokine storm. Their own body attacks the virus with such vigor that it attacks the person's heart and the person's kidney and the other organs in the body, and the body shuts down. So I think that we will have good therapeutics sooner rather than later.
Okay, and General, I want to ask you very quickly, how is it going down there as far as people complying with the stay-at-home order? What is enforcement like? What do you see?
Look, we're working real hard to ensure and to get the message out to keep social distancing. We're doing a lot of great things. Last week, we announced that we got 400,000 tablets of hydroxychloroquine from Amneal Pharmaceuticals. Today, we announced that we got 8,000 Z-Packs from Teva. And so just like the doctor said earlier, between social distancing, keeping people away from each other, helping to flatten the curve, using those medications that actually have shown to be proven in some patients that are affected. I think all of those things helps to increase the capacity of our healthcare system to basically take care of patients that have COVID-19.
Well, we wish you all the best with all these therapies and potential help that is out there. Mr. Attorney General and Dr. Weinberg, good to have you both.
Thank you.
Thank you, Shannon.